Today on NBC6 Voices, the death of film director John Singleton is a reminder that black men are hit hardest by high blood pressure. Two local doctors discuss why the silent killer often comes without symptoms or warning. And good morning. Thank you so much for watching NBC6 Voices. I'm Jawan Strader. Well, this week, fans mourn the death of Oscar-nominated director John Singleton. While admirers focused on the groundbreaking nature of his work, Singleton's family chose to highlight the devastating effects of high blood pressure. Singleton suffered from hypertension and died Monday at the age of 51 after suffering a massive stroke. Singleton spent his life advocating for black artists and films in Hollywood. Following his death, Singleton's family urged black men to get their blood pressure checked. More than 40% of black men have high blood pressure, and as a result, African-American men are at greater risk of having a stroke than any other group in the United States. Well, today I am joined by Dr. Sean Smithson and Dr. Katina Kennedy to talk about the silent killer and why black men are at greater risk here. Thank you so much for joining us this morning.
You're welcome.
You're very welcome
to be here.
Well, let's get right to it.
Sure.
Why is hypertension called the silent killer here?
Well, it's because it has no symptoms. You know, a lot of times you can walk around with elevation of the blood pressure and you won't get any signs and symptoms.
And why is it that so many black men, African-American men especially, have it?
The issue with hypertension in the African-American population is that, one, it presents itself at an earlier time than the other traditional populations. Also, black people in general have higher salt sensitivity. Therefore, they don't handle salt like regular people, and they also develop hypertension or high blood pressure at a higher age or a younger age.
And Dr. Katina, let's talk about the big three. What's the big three here?
When it comes to controlling hypertension, preventative care is key. You know, a lot of times they say we may not go to the doctor early enough, or we may only go to the doctor when we're sick. But it's important. You have to know the big three. Yeah. Blood pressure, cholesterol, and blood sugar. Those are foundational to our health. If you know your health status in the big three, you can actually do something that may prevent one from having a stroke.
I love it. Let's get to some stats here so folks at home, you can get a better picture of what we're talking about. More than 40% of black men have high blood pressure. They are twice as likely to have a stroke as compared to white men. Black men are more likely to have a stroke at a younger age and more likely to die from it. And that's exactly what we saw with director John Singleton.
Yes, and what we also have to remind ourselves about that there are other risk factors. So there are the traditional risk factors that we talked about, but there's also smoking. Smoking is another risk factor that needs to be highlighted that we have to avoid. And we also have to implement diet and exercise. Diet and exercise play a crucial role in prevention of stroke and as well as heart attacks.
Definitely. So just by being African American, that's a risk factor. Also, high cholesterol is a risk factor. Uncontrolled blood sugar is a risk factor. You know, so we really have to stay on top of our health.
You know, I just don't get it, though. I don't get it. I don't get why is it that African American men, though, are more so at risk than any other population out there. Is it because, too, of our lack of education and wanting to go to the doctor? Dr. Sean, I don't want to go to you, brother. You're going to give me some bad news. Dr. Katina, I don't know.
No, you're more than welcome to come to me anytime. However, the major thing is that you have the traditional risk factors that we talked about, but there's the other non-traditional risk factors that specifically affect the African-American community. Though that being said, there's the diet. For example, soul food, which we all love and love to enjoy, is very rich in carbohydrates as well as salt, which can predispose you to high blood pressure as well as high blood sugars. Also, there's kidney disease. Well, when you also have a development of high blood pressure that's left unchecked and unrecognized, you can actually develop kidney disease, which also makes it your higher risk level of developing cardiovascular disease.
And then we may not be participating in that preventative care that I mentioned. You're not going to the doctor. Or, you know, the girlfriend or the wife has to say, come on, I've made that appointment. You need to get in there.
Exactly.
And because most times when my patients come in, they're saying, oh, my girlfriend made the appointment, or my wife.
Well, how many times a year should I be making an appointment to come see you guys?
Definitely need to get the physical exam once a year.
Once a year.
Now, If you have any hypertension or some chronic conditions, you may need to come in often. With diabetes, we recommend every 3 months, and then with controlled hypertension, every 6 months.
Yeah, and it's easy to actually go to any pharmacy and get your blood pressure checked. It's a very easy screening mechanism that you can actually do and get your blood pressure checked. If you find your blood pressure is elevated, you should seek medical attention and then have routine evaluation after that.
Okay, well, let's look at the stroke symptoms right now. We have this full screen up for all of you out there. Now, the symptoms of stroke are sudden loss of vision, facial droop, numbness or weakness of the face, arm or leg, especially on the side of the body. Also confusion, trouble speaking and understanding, and difficulty walking, dizziness, loss of balance, and coordination. And a lot of us may carry some of these symptoms for a few minutes, not realizing that I am having a stroke.
Correct.
Yes, and time is of essence. So if you are that caregiver who noticed that someone is actually having stroke symptoms, call 911 immediately, because if you actually catch the signs and symptoms, if you go to the hospital within a 3-hour window, you can actually save that person's life.
Wow. 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 And that's what I was about to ask you. Is like, don't ignore it. No. Don't ignore it, Dr. Sean. If I do experience any of these things, any of these symptoms here, don't ignore it.
You should seek medical attention, especially if you know you're at heightened risk. If you know you have diabetes, if you know you have established diagnosis of high blood pressure, if you develop any of these type of symptoms, you should definitely seek medical attention right away.
Okay, let's look at a blood pressure chart, and I believe we're going to have this chart here to let people know, as far as the blood pressure is concerned, just where your blood pressure should be at. Because of course, when you see the high number and the low number, some people don't realize what that should be when we look at the high number. So here blood pressure is a blood pressure categories here. So it says normal, elevated, high blood pressure. Now I want you guys both to weigh in on this, because I'm not a doctor. So I will let you guys take over as far as what we're looking at.
So for a long time, it used to be, you know, if your blood pressure is 120/80, it's normal./However, the new guidelines say that if it's 120/80, it's actually elevated. So it has to be less than 120/80.
Okay.
And then, of course, when you get to the stage 1 hypertension, it's 130 between 139, and then you have your 80 and 89 diastolic.
Okay.
I think getting a blood pressure cuff from any of your pharmacies is a very easy, simple tool to screen for blood pressure, checking it on a routine basis, following up with your doctor. Avoiding salt, excess in your diet is a good way of avoiding the consequences of high blood pressure.
And that's basically what I want to get to next, the tips out there, what to do. As time is winding down, I just want to let everyone out there know what you can do in order to save your life and prevent this from happening. Okay, let's talk about these things.
That's right. Knowing the big 3, preventative care, going for your physical exams, limiting your carbohydrates, salt, sodium, eat fish twice a week. This is all part of the DASH diet. Ensure your diet includes fruits, vegetables, and fiber as well. Also, I'm an advocate for sleep. It's very important that you get adequate sleep, because if not, that is a precursor for elevation of the blood pressure as well.
And of course, limit alcohol intake, stop smoking, engage in regular exercise. I mean, it seems simple, Doctor.
It does.
It seems simple here, but a lot of us don't follow this.
Yes, yes, we have to. And you have to know your health status. I'm urging all of you all. If you haven't gone for your physical exam within the year, please go ahead and do that.
Okay, so I'm going to leave you guys with some final words out there, as far as for folks who are watching right now. What is the biggest takeaway from this as far as preventative measures?
Eat healthy, get your sleep, know your health status, blood pressure, cholesterol, blood sugar.
I think you should be aware of the risk factors, the major risk factors, as well as the non-traditional risk factors. Know your family history. See your doctor on a regular basis, and engage in physical activity. I think walking even half an hour a day, 5 times a week, has been demonstrated to reduce the risk of cardiovascular events. That includes stroke as well as major heart attacks. Okay,
can we put up those tips once again? Can we put those up once again? Because I want folks to know the big 3. Can we put those up again? Here they are right here. What to do. Here you go. The big 3. Dr. Katina, you said it right here.
That's right. Blood pressure, cholesterol, blood sugar. Know your numbers. If they are elevated, do something about it. Implement these lifestyle changes.
All right. Dr. Katina, Dr. Sean, thank you guys so much.
No problem.
All right. Hopefully I won't be seeing you guys too much. Too much. No, thank you. We really appreciate you both.